Zina Manji, who's a global fellow with HITLAB and has been in digital health and has been a part of the ecosystem and has a deep understanding of regulatory perspectives and regulatory trends and how to make sure that digital health technologies are falling into compliance with different life science regulations and different reimbursement regulations. Zina, welcome to the program. Good to see you again.
Thank you, Stan. Always a pleasure.
And she'll be talking with April Smith-Hirak, who's a regional health administrator with HHS. And with that, handing over the mic and the virtual microphone to both of you.
Thank you so much. So this is part of our monthly segment, Digital Health Focus, where we go a little bit deeper in a regulatory perspective or implications to regulatory perspectives. And I am so thrilled to be joined by April Smith-Hirak as part of HHS and giving her point of view on ViVE. So April, please introduce yourself and what you do.
Thanks, Zina. It's a pleasure to be here. Thanks all for having me. So I, as you mentioned, am the Regional Health Administrator. I work out of New York City, and I work for the Office of the Assistant Secretary for Health. And I represent our regional digital health footprint for the entire country. So even though my region is limited to New York, New Jersey, Puerto Rico, and the U.S. Virgin Islands, we really are looking at regional and other impacts of digital health for the way that we execute on policy and public health for the entire country. And I was fortunate this year to be able to attend ViVE, which was a really amazing experience.
That's great, April. I'm sure this gives you so much opportunity to look at things in so many different angles. So a lot was discussed. I think ChatGPT is all over the place, and AI certainly mentioned in this session, in this symposium as well. The important things I think that have come out so far today are, AI. It's meant to be assisted, right? I think that's where, from a clinical perspective, it's meant to assist as part of decision making. That seems to be the optimal goal here in the best use cases, augmented versus a replacement. So I wondered about your thoughts on that, April, and what you observed.
Well, certainly ChatGPT was much newer, and it's amazing to say that in the course of a month in between two conferences that something could be much newer versus, old hat in some ways. But at ViVE, being a little bit earlier, ChatGPT was much newer. People were at the very beginning stages of tinkering with it and figuring out what they might do with ChatGPT and GPT-4 technology that could impact healthcare, digital health delivery. And there is this sense of excitement about all of the capacities and all of the things that you might do. It's like a little bit like kids in the candy shop. And I definitely saw in every session, it was mentioned, and it's a little gleeful mention of like, what might we do? And here's what we could do, and here are practical applications, but very little of a hands-on, like I've been working with it. It's more like, oh, here's a use case I'm thinking of for. So I think that's probably a key difference between ViVE and HIMSS. And I didn't get to HIMSS, so I'll be interested to hear what others say about that. And I'm seeing the South by Southwest session as well. So it was very cool. I think that there's a lot of power in AI to really build on the ways in which we interact with health and healthcare. And it's probably the key determinant of how we're going to function in health going forward, if you're looking in the digital sphere. But I think it remains to be seen. It could be a double-edged sword. So it is very much in the hands of the user. And of course, there are always equity challenges and the idea of, what do you feed your algorithms? Is it good data? Is it bad data? Is it biased data? Is it unbiased data? And well, what does biased data truly mean? And there was a lot of that discussion at ViVE.
Yeah, and certainly from a government and regulatory perspective, it's part of a regulated industry. We need to look at benefit, risk ratios, as well as unmet need. What are the alternatives? As Sasha mentioned earlier, it's also takes place from a regulatory point of view as well when we're trying to build and look for approval packages and what data would actually support these mechanisms. But even broadly, as David Rue was talking about, just in the healthcare system overall and making it more efficient as well. And Glenn also talked about that. So a lot of threads here that are certainly coming together. And certainly more to come. So I think as we are in the healthcare industry and developers, it's important to keep these aspects in mind as we are thinking about developing forward. You also mentioned about tequity and how it's actually a lot more underpinned now. It's everywhere. It's an accepted aspect versus something as a new concept.
Yeah, I was really excited. And last year, of course, ViVE had a TechWitty stream as well. But this year they had a dedicated TechWitty stage, and that was wonderful. And there were some amazing panels and presentations and a lot of thought leadership that was happening, and it was great. And the thing that really excited me was that all of the sessions that I went to that were not on the TechWitty stage were talking about equity and bias and access and all of the things that we're really concerned about in public health. And when the government sphere and the private industry sphere kind of converge to create or acknowledge and come together on priorities that are so important to us as a society, it's really very heartening. It helps me to know that this founder who's presenting on a panel at a completely unrelated topic is also considering, what does equity mean? What does bias mean? What does it mean for access? Who's able to access these new technologies?
Yeah, exactly. And you were mentioning presence of government and really converging of government with innovation. And of course, in regulatory framework, there has to be regulatory innovation to meet the pace of technology advancement. And how do you create that framework that's going to be in the best way that can give rigor as well as reliability, but also not be too burdensome to actually enable the benefits that we're all talking about to come forward, to be able to test it, to be able to discover that value in practical and pragmatic ways. So what were your thoughts about the presence of this convergence of governments and institutions as well as with innovators at ViVE?
It was really nice to see coming from the government side. We have a reputation for being a little bit siloed, and it might be well earned. I'm not going to say whether it is or not. But it was on the Health and Human Services and even the Veterans Administration side. It was really amazing to see the level of federal presence at the conference. We definitely had a keynote from the head of our Office of the National Coordinator. We saw NIH out in force with their SBIR grantees and really highlighting the types of things that NIH is investing in. And we had CMS's innovation office meeting with founders one-on-one. You could register for a meeting and really just talk with a CMS person to understand reimbursement and all of the regulatory. And it was very cool to see how involved we as a federal government were in supporting innovation and really trying to not just regulate, but also enable the kind of progress that we're all really excited to see. And for me, as my office is partnering with the Office of the National Coordinator, Cancer X, and seeing Cancer X highlighted and the Cancer Moonshot from the White House was also a very, very cool experience. So it was really nice to see a digital innovation public-private partnership highlighted at a conference like ViVE and really be talking about what the potential impacts are for digital health to have a role in moving cancer prevention and cancer treatment forward. It's very cool.
Yeah, absolutely. And I think this also speaks to what Mark talked about earlier today about the democratization at events like this, really allowing everyone to come together in an area, a physical area where collaborations or discussions are happening around you and it's easily accessible. I think also something I'm always thinking about is innovation shapes regulations. So if we are, as innovators, if we're bringing things forward, discussing early on with FDA or whatever regulatory aspect that governs the digital tool that we are looking to develop, looking at the cost basis and the outcomes of improvement, it's important to start those conversations early so that we can bring everyone along on the same page and really make sure that the studies that are being done are done to actually, benefit and provide that proof and that evidence. And something Glenn talked about earlier today really struck me was we talk about risk and benefit, but it's also the risk of the status quo and not moving forward. I think that's also really important to consider, especially with the pace of advancement these days.
As government, we're not always awesome at moving forward quickly, and we're specifically designed not to, because we need to be very careful to protect the interests of the public. But the way that COVID has really springboarded a lot of the discussion and the regulation and progress and use of emerging health technologies is really impressive. And I'm very proud of the work we're doing, and I'm really encouraged to see more of it.
Well, thank you so much, April. Incredible insights and discussion with you today. I really appreciate it.
Thanks so much, Zina and Stan.
And thank you.
Stan.
Thank you, Zina and April. Wonderful conversation and really insightful too. Great to see all the different branches of the federal government stepping up and really helping out the digital health ecosystem. Wonderful to see. Thank you both.